So we would want to look at some case scenarios that you can expect to see when dealing with prioritization. You can have one patient and that patient has multiple concerns in that case scenario, and you expected to figure out which of the concerns that you will address first. Number two, you also may have one patient and that patient has multiple symptoms, and you're supposed to be able to figure out which of these symptoms are you going to tackle first. Number three, you may also encounter case scenarios with multiple clients, with multiple patients who would have their respective concerns. And then you're supposed to know which of these patients am I going to prioritize? Which patients will be my highest priority? And which patient will be my lowest priority? So let's dive into the rules that we spoke about. Rule number one, we are going to attend to the unstable client first before the stable client. So in the case scenario, look out for the indicators of client instability. So we're going to go through a list, which will be a guide to help you know that a client within this kind of category will be an unstable client, and that I'm going to prioritize that client. So look out for the indicators for client instability. Look out for the indicators for client instability. So what will make a client unstable? In the case scenario, if you're fortunate, you may have that word, the client is unstable. So look out for it. Number two, newly admitted client. A client has been newly admitted to your ward. That client should be prioritized. A client admitted less than 24 hours ago. Number four, a post-op client less than 12 hours. So freshly post-op, you're going to prioritize that client. Number five, that client had a surgery freshly post-op and also was given general anesthesia. You've got to prioritize that client. Number six, you may see in the case scenario given, this client has an acute illness. When you see acute, you know that you have to prioritize the client. Seven, the client is not ready for discharge. It means that there are still issues to address. We have to prioritize that client. In a case scenario, you're going to see newly diagnosed diabetic, newly diagnosed DVT, newly diagnosed hypertensive. We've got to prioritize. Number nine, assessment findings are changing. In the case scenario, you were given the respiratory rate, and then following assessment, the respiratory rate has increased markedly. Immediately you pick that out, know that we are going to prioritize that client. And yes, for lab abnormalities as well. If the lab value is markedly raised and can pose a threat to the client's life, is at a critical level, then we have to prioritize, such as potassium. If the normal range is 3.5 to 5, and this client has potassium over 9, clients can have a whole lot of issues with their heart, arrhythmias. So that client has to be prioritized. And let's dive more into more key points that you will look out for, more key phrases or keywords that you will look out for to pick out the unstable client. High fever. You have a case scenario, client's fever is over 40.5, around 105 degree Fahrenheit. Client with hemorrhage. That client can bleed and end in shock. Hypoglycemia. Hypoglycemia has to be prioritized. Breathlessness, pulselessness in your client, always unstable, always unstable.